Imagine a world where citizens have an Amazon-level relationship with the government. That's what the one-time mayor of Indianapolis and former deputy mayor of New York dreams about. Stephen Goldsmith is now a professor of government at Harvard. His answer for how to achieve that dream? Big data, the key to making city governments more efficient and smarter. And that's what Joy Bonaguro thinks about every day, too. She's San Francisco's first ever chief data officer charged with coordinating this city's data collection and use, and making the information available to the people who live here. And here to talk to them is Fusion Editor-in-Chief and Atlantic Contributing Editor, Alexis Madrigal, to tell us what the numbers will say. Hi, Alexis. Nice to see you.
Nice to see you, Dad. It's nice to be back in the Atlantic event where everything always runs so smoothly. They're still on time, which is just amazing to me. Every single event I've gone to with the Atlantic, which has been many, many over the years, they're always so well run, so well put together. For this panel, I want to give sort of two bits of context. I mean, one, as I was walking down 3rd Street here, I was just remembering when I used to work at Wired, which is just right down the street, a few blocks down. And this is kind of 2007, 2008, right as people were starting to get behind open data for cities, open data for government agencies. And there was just this incredible optimism that all you had to do in order to make wonderful things happen in a city or government agency was to just put the data online. And granted, I was working at Wired, so there was a utopian strain still running through the place. But we really felt like all we had to do was just get the data out there, and both just citizens and the private industry would sort of take it and turn it into some sort of magical utopia. And I think one thing that's clear, and I think that no one on this panel would disagree, that that hasn't quite happened. That a lot of data has gone online, but the processes and mechanics for connecting it into public policy, for giving underrepresented groups a greater voice in public policy, those things actually haven't happened. And so one of the things we're going to talk about here are what those processes and mechanisms for connecting data into the problems that cities have and solutions that they could have. It's going to be one pillar of the conversation. And the other is, in many cities, maybe less so in San Francisco than some other places, a lot of the infrastructure is crumbling. The information technology networks that we're talking about here that are sort of now spread over cities, cellular networks and mobile devices and high-speed internet and all these things are just kind of the latest of a bunch of networks that form cities. And the lower layers in that city stack, like the roads, the electricity, the water infrastructure, are having all kinds of problems. So we're going to talk about the interrelationship between that kind of infrastructure and information technology. So why don't we start with you, Stephen? And let's just talk a little bit about applying things to a particular problem. So how can data, and actually maybe both of you can answer this question because I know you've written about it recently and you've been intimately involved. Take the problem of homelessness in San Francisco. How can data actually play a role actively in helping public policy people come to better solutions around homelessness in San Francisco?
You're doing it. You should go first.
I'm not doing it.
I just teach it that way. I can critique it.
Others at the city are doing that. So I think, this is a great example. So homelessness is obviously a long-standing problem in this country, and we can debate the origins of it and all of that. But the reality is most of the burden of solving it is landing on cities. And in San Francisco, we do many, many different things around homelessness in the city. And as part of that, in any city, they do every 2 years they do a homeless count, right? And that's actually required by the feds. And what we found in our homeless count is that, and based also on the data from our services that we were providing, is that there was sort of this unmet need. So if you sort of think about people who are homeless, they fall into different groups. There's people who are in families. There's people who are chronically homeless. There's people who have illness or mental illness. There's young adults. So if you start to think about these as being different populations and you quantify those different populations and they have different needs, then you can start to engage them with services that meet those needs. And one of the unmet needs that we discovered was we were able to sort of slice out a part of our population using data that were chronically homeless people, but very stable people. They were part of local communities, essentially. And but they had lots of possessions. A lot of them have dogs. And so that made it very hard for them to take advantage of the homeless services in the city. So our mayor and Bevan Dufty, who's our sort of homelessness czar, put together something called the Navigation Center, and it's this place where those people who had not been traditionally served because our services wouldn't serve them, it's one single place where they can go to get their needs met and bring their possessions with them. We even have a dog run for them to, have their dogs, and so meeting that community need. And so importantly, though, in doing this, from day one, they incorporated an evaluation team to say, what's the information we should collect at intake? What's the information we should track throughout the process? What's the information we should use to decide when people sort of graduate out of the Navigation Center? And so it was about using data to identify and help define a problem and an unmet need, but then designing a program and then the data to weave throughout that program to actually, see if we're solving and we're meeting the objectives of the program.
And Stephen, what are the lessons that you would draw from that example to apply them more broadly?
First, let me say how disappointed I was in the answer, because the last sentence should have been, and you can read about it in Steve Goldsmith's
Oh, sorry.
blog.
Yeah, he wrote a wonderful article about this. Yeah.
I was just waiting, and
Okay.
it never came. But there are a number of lessons, and this is a good experience. But let me answer slightly more generally, because actually you could use homelessness and data to illustrate several different points. So I think the first, which is set up by Joy's response, is that government is a set of vertical agencies dealing with horizontal problems, right? And so you have why is a person homeless, right? Well, they have a drug problem, they have a domestic violence problem, they have a transportation problem, they have a child problem, they have a and there is an agency for each one of those, right? And so, and each one of those agencies works fairly intensively with a set of activities in there. So now you say, okay, and then each one of them had previously their own data system that didn't connect with this data system, et cetera. But now we have technology that let us mine the data. Now we have technologies that let us do predictive analytics. Now we have data that suggests, okay, what is the problem? Why are not more people showing up at homeless shelters in the city of San Francisco? Well, it turns out that they don't want to leave their pets behind. They don't want to leave their significant others behind. They want to leave the material. So now you identify. So that's one set of issues. Another set of issues is, well, how do we use the data to identify outliers, right? So where are the chronic places where homelessness occurs? Why is it occurring in that situation? Then you go to the next example, right, which is that there are a lot of agencies, all well-intentioned, including the many nonprofits dealing with intractable problems of homelessness. But you know what? They're not all excellent, and they're not all excellent with the same population. So let's use the data to figure out which agency, which provider, and many of these providers are under contract with the city, which provider is good with what types of population, what types of circumstances, and then begin to tailor those resources as well. So now you can solve problems, right? And you can measure and evaluate the problems that are solved. You can figure out what the drivers are of those. You can reorganize your resources in an effective way. Now, all that, that's about 3/4. And I have one more kind of intersecting point, which is, actually, many of the poorly served communities lack voice. And not only do their advocates often lack voice because they're underserved communities, but the folks who are underserved, whether they're homeless or whether they're in need of workforce training or some other assistance, should be able to actually evaluate the quality of the services they receive, right? They should be able to be encouraged to respond, and as should their intermediaries. So we have social media information, we have intermediary information, we have provider information, but the whole world in terms of these resources has changed, which is why it's so interesting that this navigation center is at the kind of the front door of the system delivery, and it can organize those resources effectively.
You mentioned a phrase which I'm sure most people in this room have heard, predictive analytics. And what are the ways that cities are using predictive analytics that they're drawing on open data sources? What are they actually trying to predict? I mean, the examples that I've heard of are like policing is sort of the most prominent that I've seen. But are there other ways that cities are doing?
Well, there are many. It's obviously relatively new. When I was deputy mayor.
Maybe you could give like just a brief definition so everybody's kind of on the same
Okay.
page.
Well, so let's start with tangible events. Then we'll get to intangible social services, which are more difficult but also more promising in terms of predictive analytics. So I'm sitting in City Hall in New York City 4 years ago or so, 3.5, 4 years ago. I worked for Mike Bloomberg. And a family died in a fire in an illegally converted building, right, which we have in all large cities. And I was reasonably confident that I would get an inquiry from the large New York papers about whether the city had received any complaints about that building. So I called the fire department and said, have you received any complaints? And they said, well, we got 1 or 2, but we also get 40,000 complaints a year, so we're. And I called the buildings department, got the same answer, right? And they weren't insensitive answers. They looked like we're doing our job, we got a complaint, and went out and then in the back of the city hall was a guy that I wrote about in my book named Mike Flowers, and I think he had some kind of secretive past, but he said, just like, give me 60 days.
Yeah.
Yes. And I'll come back with some suggestions. And he got mortgage foreclosure information, tax delinquency information, 911 calls, 311 calls, code enforcement, and one other set of data, right? All easily accessible, the sort of stuff that Joy now does every day, but back then it was, back in the old days, 4 years ago, it was a little more complicated. And predicted by 1,000 times over which of the complaints would lead to a fire. So now that we increased our predictability by 1,000%, we took a building inspector and a fire inspector and sent them to those 300 to 500 buildings and said, let's figure out the problem, right? Is it a sprinkler? Is it a criminal issue? What is it? And let's solve it before the fire occurs.
How did you know that model had such good predictive power? You ran it on historical data.
Yeah.
And it predicted places.
Right. So I think this is a really fascinating question. I live in a world where performance should iterate and perfect is never possible, right? So the question becomes, and I've been trying to do this a lot in the area of child welfare. Annie Casey Foundation has a grant to the state of Indiana to look at having these decision support tools help caseworkers who are doing child welfare work in homes. Look, the whole goal here is that some set of algorithms should help us, informed by day-to-day experience, should help us predict what happens. And I think the answer is you just take your best guess and you look at it and then you keep working at it. And there's that combination of the fact that those are easily accessible sets of data and they prove to be kind of powerful in their prediction by looking retrospectively and prospectively.
One of the questions I have, one of my best friends is a social worker up in Seattle, and he's working on some programs up there. And they have to enter in lots of data about how their programs are going, where they're kind of taking a subjective evaluation of something that happened and trying to turn it into a quantitative evaluation, which then can be used in these sorts of conditions. When you're looking at data coming into the city's data coffers, it's going to go into the data catalog, what kind of sanity checks can you do on things where it's like the actual data creation process is complicated?
Yeah, no, I mean, I think that just goes to classic data quality techniques. So there's not a lot of mythology here, or magicalness. It's just, there's certain rules, like you put validation, or you use controlled vocabulary with drop-down menus. The problem is, and then you do staff training on it. So that on some level is straightforward. The challenge and the problem in city governments is we're working with a lot of old IT, and maybe it's hard to roll out those kinds of quality controls and implement those quality controls consistently. Never mind the fact that they're old systems that maybe the data we were collecting was because some funder said we had to collect it versus is it tied to the outcomes we're trying to get from this program. And so I think that's easy. It's the retrofitting that is the complicated problem. Going forward, that's easy. Like the navigation center, we decided and then we implemented that in a new system. So that was straightforward and everyone got trained on it. It's those old systems. And I do want to add a note. So I think predictive analytics is sort of one tool in the toolbox. There's actually a lot of other tools, from starting with descriptive statistics, which is actually really important to understand the shape and nature of a problem, to I'm actually a big fan of having random controlled experiments wherever we can, because then that actually tells us if what we did worked. And so I think it's more about a blend of techniques, and part of getting to that blend and knowing when to use the right tool in the right circumstance, we have to increase our overall data literacy.
You know, you said something to me in our preparation, which I think was really interesting. You know, there are these catalogs of data that exist out in the world, and I think if you're familiar with this, basically you go to San Francisco's data catalog, or you know, kind of a famous example that sort of a lot of other things were patterned on was Washington D.C.'s data catalog, where you could just go and see, okay, the city has X data sets, and you can get them in the formats that you'd like. But you said to me that you weren't sure that data catalogs alone were like the way to make the best use of open data, and you said that thematic and strategic data releases could let data have more impact. Can you just tell us what that means? Like, what is a thematic and strategic data release versus just kind of dumping it on the internet?
Yeah, no, so dumping it on the internet. So I have a background in usability and human-centered design, and did a lot of work on data democratization in New Orleans, and just pushing out data is just, in a lot of ways, can be another form of disenfranchisement, right? So if you have the technical skills and the technical know-how, maybe you can lift it up and do something with the data. But if you don't have of out there and it's open data dump, it's not open data for public good. And so what we're trying and what we are migrating to in the city is something we're calling strategic or thematic releases. And what we're doing is we're saying, what's an important public issue? And let's try to release a lot of data around that issue, but then tie it to a product or an event that helps unpack and demystify the data and makes it usable and accessible to a local audience that's probably more focused on issues, not just like what app they can consume that happens to use open data from the government. So that's the direction we're going. We'll, of course, continue just putting data out there, but this is a key strategy for us to really make open data relevant for our local audience who really care about big key issues and need a way in which to engage on those issues and understand the data behind those issues. Data that's traditionally been locked up in back-end systems.
Stephen, can you give us, just from your research with cities around the country, can you give us just one example of a great success with open data and one example of a big failure?
Well, the failures are multiple, but they're not big. I mean, in the sense that it's kind of like Joy's comment. Well, let me back up just for a second. So the open data means a lot of different things, and the movement has continued to improve. You know, New York City was a leader in open data before I got there, but open data meant put up a lot of ugly PDF files that were totally unusable, and then check the box and move on to something else, right? Because the public officials didn't see the benefit of open data. It looked like we're just going to get beat up by the media and other people who see our data, right? So that was the early part of open data. And now we see the migration or transition of open data to open data well visualized, open data with APIs that people are able to use, open data that's that allows for the co-production of public services. So I would say that the failures are failures of check the box open data as contrasted to usable open data. The advantages, I think, of open data are those that are most, there are a couple ways. One, that allow discoveries by the multiple, probably in the room today, of kind of app developers who take the open data and build something out of it. Another way to think about it is less spectacular, but I think maybe in the long run more important, which is, you know, Chicago really has probably the most comprehensive set of everything, if you will, because they have a Windy Grid open data platform, but they have, courtesy of the Community Trust in MacArthur, a intermediary, Smart Chicago, who then helps translate the open data for the nonprofit groups that service communities. And so I think it's the usability and visibility of the open data for community groups to both allow them to advocate and also it allows them to suggest solutions to problems in their community. And I think probably that set of things in Chicago may be the best example.
To look at. Before we go to audience questions, I want to talk a little bit about the other bit of context you mentioned at the top, which is what role open data and sort of networked governance in the way that we're kind of talking about here will play in sort of helping deal with crumbling infrastructure within cities. And either one of you can start with your sort of vision for how that could work.
Well, in that case.
Or places where it is working already.
Well, so, I mean, we were talking about this as we walked in the door, and Joy made the insightful comment that data doesn't make up for money, right? If your infrastructure currently seems to be intuitively obvious, but let me think about it a little bit more subtly, and then she can make her own point again. So let's think about it in the same way the conversation has been moving on, right? So in a couple of different ways. One, which is not how you meant it, but that open data should visualize the communities that are being least served by infrastructure investments, right? Where the sidewalk dollars, let's look at where the sidewalk dollars are being spent. Let's look at where the police stations and the parks departments are being, let's see that collection of investments. Let's look at how long does it take to fix a pothole or take down a problem in one community versus another. So that's not how you meant it, but that's one way to think about the allocation of scarce public resources. Another way to think about it is the following, right? So, I was a mayor of Indianapolis decades ago, and if you wanted to move traffic more quickly, you built more lanes of traffic, right? Well, this is obviously quite counterproductive. And so now the question was, how would you use data to move traffic? You might want to use data not to move traffic at all because you want to have bicycles, which is a different issue, right? But if you say we want to use data to move the traffic that we have more efficiently, so we monitor easy pass sensors and GPS readers in the taxi cabs, and we synchronize those to the street lights, and we move traffic more uniformly in real time without a lot of interventions setting the signals as you go. Or let's say that cities have substantial problems, older cities do, with leakage out of their water pipes, right? It's 40% nationally probably across the board. Now, most of the better utilities are putting sensors in the pipes so they can identify leaks more quickly, right? And the same is with respect to sewers and the like, and pavement readers in the asphalt. So it doesn't solve the big questions, but I do think if the issue, in any one of these issues, there's a limited amount of money, and I think we could agree whether you're kind of small government or big government, that we ought to at least spend the money that we have the most effective way. So I think that data does allow us to manage infrastructure in a way to do preventative investments, identify problems early, allocate the dollars more effectively and equitably, and at least it's a start. It doesn't make up for the fact we're not spending enough on infrastructure, though.
Yeah, I would agree with that, and I think, maybe at a summary level, to the extent that it increases visibility of the problem and an understanding of the problem, then that allows maybe more people to be putting their head around it and wrapping their head around it. And I think when it comes to infrastructure in terms of financial investment, when people, let's build this bridge, often, if it's critical enough, the money can follow through. And so I think that visibility and then using data to optimize where we put infrastructure going forward and saying, okay, maybe, we shouldn't be putting it there because it's not being used there. And so I think that can help let us plan more thoughtfully, even if there are less dollars.
Let's take a couple of audience questions. We probably have time for two. Get your hand up quick. There's people with mics. We have one right here. Sorry.
I will. David Sobel, San Francisco Housing Development Corporation. Clearly, as a nonprofit organization leader, the emphasis on data is more and more prevalent, not only on applying for funding, but tracking outcomes. And it seems like we still have a long way to go on two components of that. One is getting the data from the users, our clients, without invading privacy, confidentiality issues, especially on health outcomes. But so many outcomes are interrelated. And so I'm kind of posing the question of how do we overcome privacy, confidentiality issues, not only within one organization, but across, because to really track outcomes is going to require kind of cooperating across many organizations and our funders, both city agencies and philanthropic entities. So I guess there's two pieces to that.
Yeah.
Yeah, it's a huge problem. So if you look at the history of privacy law in the U.S., it was essentially happened within distinct verticals like healthcare, HIPAA, consumer privacy. It's like, and we have all these various verticals in which private information is regulated, and it's complicated by the fact that that repeats itself at the state level, and then of course in San Francisco we're pretty active, so we have a lot of local laws around privacy. And so, I mean, Stephen mentioned earlier, these were policies that weren't designed for coordinated care. What's sort of interesting about a lot of our privacy laws is they end up disenfranchising our most vulnerable people from accessing a complete and coordinated system of care. I don't think anyone has an answer for that. I mean, you can just Google this, and every locality is figuring this out over and over again. I personally think, and this is me, I think at the local level we need to be more aligned, and that's actually something we're working on. At the state and federal level, I would like to see more guidance, and specifically coordinated cross-agency guidance. So, if you're a housing authority and you need to collaborate with your county hospital, this is allowed and this is what it's allowed under, right? But that's not out there. In fact, if you Google cross-agency guidance, there's something from 2008 or 11, I can't remember, and actually like precipitated a change to something. So it's like no one's providing that guidance, and so every location figures this out afresh and new, and are probably doing a combination of over and under protecting private information as a result.
And let's go to the last question, just because we've got 2 minutes. If we've got one, or you could answer that. Okay, well, let's go with it.
You represent 100% sample of those who've asked us questions. So, I want to take advantage of the question to think a little broadly about this, the whole setup of the conversation, right, which is this kind of coordinated care. So let me talk about Indiana for a second. So Indiana had this grant from Annie Casey Foundation to develop a casebook for a child welfare worker, right? So the same could be for a housing interventionist. And so then they took all of the information that would be important to the caseworker, and these caseworkers have a really tough job, right? Making very dangerous decisions in very traumatic circumstances at very high risk. So now all the information's in a tablet. So now the caseworker goes into the home with a tablet trying to interview the person, and just now she has all her information in a tablet, but she can't actually use it while she's doing things because it's just not well organized. So then you say, well, let's use a decision support system. So we're going to say to her, if you ask question A and you get such an answer, you should get question B. And you go, well, that's okay, except what about her siblings, right? Or did the young girl show up for school that day, right? What about the school records, or what about the health records? You can do the same thing with housing or homelessness. So it turns out that every one of those areas has some federal privacy law associated with it, and that at every level that you move from the feds to the state to the local lawyers, the lawyers become more severe in their restrictions and interpretations of the law, right? So you watch us, we can make it even more difficult for you. So when Linda Gibbs, who was Deputy Mayor of New York for Social Services when I was Deputy Mayor of Operations, wanted to create coordinated care, and we had these meetings, like every time we had a discussion, right, the agency would bring its lawyers to tell us why we couldn't do what we wanted to do. And the more times we said we don't care, the more lawyers appeared at the meeting, right? So when Indiana went then to try to solve these problems, the technology was not the problem at all. It was this kind of, what's the right blend of privacy and non-privacy? Now, just to orient the conversation, I'm almost done with this kind of, I'm talking about individuals who are in need of services. We'll leave out in a second, we'll just flag folks who are kind of walking down the street anonymously, which is a whole different subject. And so that Indiana experience geared to reducing infant mortality A year later went into place, but in that 12 months, it was one legal fight after another, and it did not get solved until the governor of Indiana appointed his general counsel as the advisor to the interagency working group to referee the decision. So I don't think it can be resolved unless the mayor or the governor assign someone. And then I think that conversation also applies to agents of the state who have contracts with the state to deliver services. So they in some circumstances come inside that, and then certain individuals who work in certain agencies have information and the like. And in the end, I think we can do it. I would also just say, in closing, it's a whole different issue if you're walking down the street. Not enough cities have privacy policies, archiving policies, forensic investigations, who can investigate it and the like. But if we could solve this issue, we could help a lot of folks, and I think it takes leadership at the top.
Thanks so much. Thank you, Margaret. Thank you.